Hi, good afternoon, everyone. How was lunch? Are we tacoed up and fajitas up? Awesome. Thank you. So, good afternoon and welcome to our session today, How to Improve Nurses' Knowledge and the Use of Patient Engagement Technology. My name is Christina Santoro. I am the Director of Clinical Education here at GetWell Network, and I am also the nurse planner for the conference. So we are pleased to have you here, and thank you so much for your engagement and attention over the past 2 days. During today's session, our presenter from Atrium Health will share her experiences on staff competencies. I, in planning the conference, put myself as the introducer for this session because as I am part of the Learning Center at GetWell Network, training, education, competencies are what I love, eat, breathe, and so I am happy to be here with Michelle to hear all of the great things that she's done at Atrium. We're going to hear how Atrium increased their patient engagement technology utilization by including a validation item in their annual competency assessment. So it's my pleasure to introduce our speaker. Michelle Reibel is a service line nurse educator for the resource team at Atrium Health. She manages the educational and credentialing needs of over 1,000 resource teammates. It's a lot of work. Her most recent process improvement project focused on improving patient outcomes by increasing the understanding and use of GetWell Network within Atrium and the resource team of med-surg nurses. Before stepping into her role as the nurse educator for the resource team, Michelle worked within the quality division at Atrium Health. She analyzed trends to identify opportunities and implement strategies for process improvement to guide improved patient outcomes. After hearing from our presenter today, as we've done in the other sessions, we will open the floor to you to ask any questions that you have of Michelle. And before we get started, I just need to share our favorite disclosure statement from the Maryland Nurses Association. So the Maryland Nurses Association is an accredited approver of continuing nursing education by the American Nurses Center, Credentialing Centers Commission on Accreditation. If you wish to receive a CEAC for this session, as you have the other sessions, please just go within your app, locate the survey there, and indicate that you would like to receive a CEAC. We will send you a certificate to the email address that you provide, so please use the email address that you want us to send the certificate to. So in compliance with the continuing education activity credit conflict of interest disclosure requirements, we'd like to announce that the presenter today has no conflict of interest identified. So please help me welcome Michelle Reibel.
Thank you so much, Christina, for that wonderful welcome. All right, we'll just get started. I guess you've probably seen this in the previous presentations, but this is our facility information. Atrium Health is a 40 hospital has 40 hospitals and 900 care locations in North and South Carolina and Georgia. GetWell Network, 11 acute inpatient hospitals within Charlotte, the metro area, and 2,700 active GetWell Network bed licenses. We started with GetWell Network. Partnership began in 2012, and the goal here is to drive patient satisfaction and engagement through our interactive patient care. So, as already stated by Christina, this event will provide an overview of integrating interactive patient education learning into annual nursing competencies, with the intent to improve use and understanding of the technology for float pool nurses within the medical surgical service line. Initial data, barriers in achieving goals, solutions to these barriers, and final outcomes will be presented. So, the importance of patient engagement. So, a little bit of background information. I thought this was incredibly interesting when I pulled this information up, but 20% of all patients who are admitted to a U.S. hospital make a repeat visit within 30 days of discharge, costing over $41.3 million in 2018. That's 1 out of 5 patients are readmitted within 30 days, a 30-day readmission rate. That's a lot of patients. So this is why we're concerned about improving how well nurses use interactive patient technology. It's about improving patient outcomes and reducing patient readmissions. Specifically, 30-day readmissions, for which healthcare systems are not reimbursed if these are Medicare patients. Research shows that patients who are more engaged in their care are likely to have better health outcomes. And you can see here, I just found really interesting that they're less likely to experience falls. They have shorter length of stays and reduced readmissions. They have a better understanding of their medical condition, their medications, and their post-acute care plan, which is so important, keeping them out of the hospital. And they're better able to participate in their day-to-day care while they're in the hospital. Another very important fact. The Get Well Network provides a powerful vehicle to increase patient engagement through patient education. So we identified a problem within our medical surgical cardiac service line as it related to ordering Get Well Network videos for our patients. Basically, underutilization of the Get Well Network. So less than half of our nurses were ordering videos for their patients. The sample here is resource team, or maybe better known as a float pool for people who aren't familiar with the resource team at Atrium Health, but basically a float pool. And the nurses who work primarily on the medical, surgical, and cardiac units. That was our sample. At Atrium Health, like I said, we refer to our float pool as the resource team. And it's a separate division within our system that encompasses many different service lines and teammate roles. But this particular project focused on our med-surg cardiac nurses, as they have the greatest opportunity to order the Get Well Network videos for their patients. We needed to know why, so we did a little exploring. And so the next few slides will walk us through the important project, the improvement project that was put in place, and then where the data led us. What did we do, and why did we do it? We knew that the research supporting improved patient engagement is linked to improving patient outcomes. So we wanted to develop a performance improvement project to improve the understanding and use of Get Well Network videos for targeted team of resource team nurses. This was a study of 161 nurses, and we wanted to know if adding the Get Well Network item to the annual competency would increase the number of Get Well Network videos prescribed and completed for the patients cared for by those resource team med-surg cardiac nurses. So our project goals. The first goal was to increase by 15% the number of Get Well Network videos ordered by resource team medical surg cardiac nurses. And the second goal, which is actually the most important, was to increase by 10% the number of those Get Well Network videos ordered. Make sure that they're actually watched by those patients. We really needed that second goal to drive home this project. We had 3 process goals. We started with the basics by educating our nurses on Get Well Network. We did this by having them complete 3 Get Well Network learning modules within PeopleLink, and they're listed right there. The second process goal focused on ordering videos. And then the third, again, brought it home with an emphasis on having our nurses follow up with their patients to ensure that at least half of those patients who were prescribed videos actually watched them. These are the 3 learning modules within PeopleLink. So we also needed to have a better understanding of what our nurses knew about the Get Well Network in order to develop a competency item that would best fit our goals for the project. So a pre-intervention learning needs assessment was created to develop targeted nursing education. We found knowledge gaps for Get Well Network functionality. Finding and prescribing health videos was identified as an issue. The why behind incorporating Get Well Network into patient education Many nurses were surprised to learn about the impact of Get Well Network it has on its patient outcomes. Our nurses they're focused on their daily activities, the daily needs of their patients, and not always so much thinking about the 30-day readmission metrics or other metrics that our system leaders are looking at. But when they saw the data and they saw how much it was impacted by teammates actually prescribing these videos and our patients watching them and the improved outcomes, they were really, it really helped engage them. They were surprised by this, and it was determined to be a major motivating factor for these teammates. And our competencies were, validation items were developed based on these results. Additionally, nurses were under the impression that ordering these Get Well Network videos would just take too much time, that the nurses already had a heavy patient load, they were high acuity patients, and they felt that there was just one more thing that they were being asked to do. It was really important to minimize barriers. So it was important to make it clear to the nurses that ordering the videos was not only simple, but also a time saver for them. They learned that the education ordered is linked to the patient's EMR and Cerner, and that the patient education is automatically documented, and this is definitely a win-win for them. Also, they were not in this alone, as all the members of the care team are educated on how to encourage patients to watch the Get Well Network videos. So we have our healthcare techs, our patient safety attendants, and other teammates that are in and out of the patient rooms encouraging our patients to watch the videos. So armed with the results of the learning needs assessment, we had the evidence needed on which to base the Get Well Network competency items for our medical surgical nurses. The objective was clear: demonstrate how to help patients and their families become active partners in their care through interactive patient care technology. So at Atrium Health, we use the Donna Wright model of competency assessment. This includes identifying a competency objective, which we did, identifying the domain, in which we did that as well, and it was interpersonal or technical skills, and also identify the method of validation. And there are several methods of validation, but the three that were chosen were evidence of daily work, exemplar, and in-service. So this is a snapshot of our competency packet, and this is just the item right here that you see for the Get Well Network, the interactive patient item. And you can see we have our evidence of daily work, our exemplar, and our in-service. Turns out that evidence of daily work was very popular. We had 92% of our nurses choose to complete that as their competency item. 8% completed the exemplar, and no one decided to do an in-service. It was important to make sure that our teammates had all the tools they needed to be successful, and we are so fortunate at Atrium Health to have a dedicated Get Well Network SharePoint page that's managed by an incredibly knowledgeable and helpful Get Well Network team. Misty Avery is an invaluable resource for all of Atrium Health with regards to Get Well Network. She is my go-to person. One of the concerns teammates had regarding Get Well Network videos was the ease of ordering. Teammates were directed to the Get Well Network SharePoint site, and they could easily access the library of videos and were taught how to create a list of favorites for their videos that they prescribed most often. So that was really helpful for them to have that, to have the job aids ready at hand. So something that we thought about before we were actually putting this in place was to make sure that we had the tools that our nurses needed to be successful. We needed to make sure we had those on the forefront so they would have the tools that they needed to be successful. So this study was a PDSA, a Plan, Do, Study, Act, and nothing ever goes as planned, right? reporting for the resource team turned out to be a big challenge. Reports are generated based on the facility and the unit level, but our team floats. So our team is everywhere, not just at one facility, certainly not just at one unit. So the reports really didn't work for our team. We had to come up with a different way to measure our success. So we had to revise our goals. We pivoted. We changed the competency, which is typically a no-no. You're not supposed to change it once you publish it, but what could we do? We had to measure it. So we did. We changed the competency item to order purposeful Get Well Network videos for 20 different patients with a 50% completion rate for 10 videos watched. And we created a form for the nurses to document that information. So here's a copy of the video log right here. And then the second page right there is actually a list of the units where the Get Well Network videos can be reported from. So we have reporting on those units. That was important too for the nurses to know because they would reach out to me, hey Michelle, I should have a lot more videos because I ordered all these other videos on these patients, and I would have to explain to them, well, we don't have reporting on those particular units yet, but we're getting there. But since I was able to at least identify those units, I gave them a heads up. So they wouldn't, I wanted them to order the videos regardless of whether or not we had reporting, but this also helped them understand if all of their orders didn't show up on the reporting, which was important because it can be a frustrating thing for the nurses if they don't see that their work is being counted. The data results for video ordering and completion was retrieved via Get Well Rounds reporting. That was very, very helpful. So, results. How did we do? Overall project goals. So revisiting our goals, we wanted to increase by 15% the number of Get Well videos ordered by our resource team med-surg nurses. And we also wanted to increase by 10% the number of Get Well Network videos watched by patients. How did we do? Well, we did okay. The number of monthly Get Well Network videos ordered by participating nurses more than tripled during the study. It's pretty impressive, 708 to 2172. That's pretty good. There was a 38.5% increase in the number of Get Well videos completed by the study end, which was higher than our goal. We were very pleased. And there was an 81% increase in the number of unique participants prescribing videos by study end. That was a new one for us. Is this live? Oh, it is live. I'm going to walk over here and talk you through this slide right here. So this was the Atrium Health goal right here of 30%. In January, and the resource team performance is shown here in yellow, and Atrium Health Primary Enterprise is in red. And I want to point out that Atrium Health resource team is encompassed in this red line as well. So back in January, well before we started the competencies, we were at 26%. We launched in April, and we had a nice tick up. We got up to 39%, so well over the Atrium Health goal of 30%. And we had a slight tick down. But I do believe that maybe some of our performance here helped lift a little bit of our overall Atrium Health performance as well. This was our little surprise bonus data that we got. So initially we weren't measuring this, but we found this to be really important. In January, out of our team of 161 med-surg nurses in the float pool, 72 of them had ordered videos for their patients. By the study end, that had almost doubled. So we know now that at least 140 of these teammates know how to order a video. That can't be the excuse anymore. They can't say, oh, I just don't know how to do it. Well, yeah, you do. So, a post-survey. We found that participants believe that the use of the Get Well Network really did improve patient outcomes. And we showed that data to them. Nurses in the study stated that they had an improved perception of the technology and were now more likely to incorporate it into their daily patient care. And they agreed that encouragement from leadership would increase utilization and help make it stick. So they really did want leadership to encourage them to use it. They wanted to see leadership make that a priority in order for them to make it a priority for them and incorporate it into their daily processes. So some learnings and recommendations. So after incorporating this into the competency, the Get Well Network into the competency item for the annual competency assessment, we know now that our nurses are competent in both ordering the videos and getting their patients to actually watch the videos. And they are harnessing and leveraging their other healthcare teammates. So their healthcare techs and their PSAs, they're definitely asking them or having them help them with this. Leadership can encourage teammate engagement in the Get Well Network, and this is so important. We have to have our leadership engaged, actively making utilization of the Get Well Network a priority for patient care, the patient care team. And it doesn't mean just the nurses. It has to be the healthcare techs. It has to be the patient safety attendants. It has to be the providers. It has to be the whole team. It takes a village. It's important for leadership and everyone to really recognize teammates who are performing well. This next bullet might come with a little bit of controversy, but I really believe that holding teammates accountable by setting goals, both individual and unit-based, will help drive the improvement. If there's no accountability, then a lot of times people will not complete the task. They just won't do it. Sharing data with the teammates on a regular basis. That's very powerful. Letting them know how well they're doing, or if they're taking a dip, they need to know where they are. Next steps, maintaining momentum and spreading success. Okay, well, I think it's important, like I mentioned in the previous slide, to share the data with the teammates and let them know what a positive impact that their work is having on the patients. And it's important to incorporate the Get Well Network into other service line annual competencies, and we did do that. We incorporated it into our patient safety attendant annual competencies last year as well. Adding the Get Well Network learning modules to the initial orientation competency validations. We're not there yet, but as part of the resource team and the resource team nurse educator, one of my roles is to orient teammates. And so what I do, since I'm in charge of orienting, I make them take those learning modules. So I assign them, and I have a whole slide dedicated to the Get Well Network in my orientation. And people, the teammates appreciate that. They know that it's an important metric for us. We value it at the resource team, and they take it seriously. Enlist super users to help encourage use of the Get Well Network. So leveraging all your teammates. And if there's one teammate or two teammates or a handful of teammates, and they're really good at it, get them to help other teammates use it and have them champion the cause. It's very helpful. And create user-friendly job aids to assist teammates in navigating the ins and outs of the Get Well Network. And if you don't have a team like Misty and Jessica, and I have to just give them so much credit. Their SharePoint is so user-friendly, and it's made it a world of difference for our team in using the Get Well Network and making sure that our patients are having these videos ordered and watched. But it does help quite a bit if they know how to use the product and they understand it. And of course, celebrating success while holding teammates accountable. I think those two go hand in hand. You can't have one without the other. And now I'm ready for any questions.
We're about to go live in Durham, North Carolina, the VA Medical Center. What metric would you recommend tracking during the go live process? How often would you recommend tracking that metric? And what delivery method would you recommend to share with the staff?
Well, ordering, the number of videos ordered. And you have to understand this is a unique study because it was the resource team. But I know that Misty does great work throughout all our facilities, our 9 facilities, and that reporting goes down to the unit. So if you're piloting at a certain facility, you could pilot on a couple of units and just start by how many are ordered. You can start by the engagement. Who knows about it? Who knows what it is? It kind of depends on how you're rolling it out and how you're educating the teammates on the product, on the Get Well network. But assuming that everybody knows about it, I would start by, and they know how to order it, I would start with ordering. This is where we are. This is our baseline data. And this is how many videos have been ordered for this unit in this time period, and this is how many videos were actually completed. Having that completed, the number of videos watched, is the most important. We had a lot of teammates, a lot of nurses that were ordering, that were at the top of the charts. They ordered 60, 70, 80 videos, but they had like 10% completion rate. And I had to talk to my leader about this because I was like, good for them for ordering it, but it's the completed ones that I really want to focus on. I'd rather have somebody order 30 videos and have 28 watched than have somebody order 60 videos and have 10 watched.
How often was that feedback shared with the staff? Was that weekly, bi-weekly, monthly?
For me, we did it during our monthly unit-based council meetings. Again, this is the resource team, so it's a little bit different, but you could do it on a unit. You could post the results on a huddle board. You could have that information on a daily basis. You could have it on a weekly basis. Probably more meaningful if you spread it out just a little bit, maybe on a weekly basis to start, to let them know. I think that's how I would do it.
Thank you.
Sure.
Hey, good afternoon. Sorry. I'm Ann Rhodes. I work for Baycare in Tampa. We also use the Donna Wright model for competency assessment.
Mm-hmm.
Great model. If you don't use it, use it. I had a couple questions. The videos that you loaded, I assume it's on your people link. Is that like your online learning or
It
whatever?
is.
Yeah.
It is.
Those 3 videos, did you get those from GetWell or did you develop those yourself?
Oh, I'm going to let Misty answer that question. Did we? Oh, Misty made them. I'm telling you, you need a Misty.
Okay.
Everybody, get yourself one of those.
I feel like I could be Misty, but the survey that you created, I'm just wondering if you're interested in sharing those questions if you
Oh,
have them.
absolutely.
Okay.
I can provide that for you.
And then for my Get Well people in the room, the reporting part of it that she mentioned is so key. So I am also the educator for our float team, and our float
Mm-hmm.
team covers 4 campuses. So
Yeah.
it's very hard to get data because the report doesn't come per person, it comes per unit.
Yeah.
So if somehow you can fix that executive dashboard to give me information on my people, not just my places.
It's a 4-hour process.
Yeah,
And
it's
your
not
eyes
easy.
are like
Yeah.
cross-eyed by the time
Yeah.
you're done.
And I have
going through
90
it.
team members on my float team, so.
Yeah, I got 1,000.
Yeah. Oh, geez.
So.
Bless you.
No, but the sample size,
Bless you.
I know it sounds worse, was 160, so not
Okay.
as bad.
Yeah.
But
And do you feel like you're maintaining like
No,
that?
no, we're not.
So-
I wanted to get, I'm so glad you asked me that. No, we're not maintaining. And the number one reason why we're not maintaining, drum roll please, accountability.
Yeah.
We're just not holding our teammates accountable.
Yeah.
And that will come. I mean, there's other things that we're holding them accountable for that leadership feels that they want to prioritize, and they just don't want to just dump a bunch of stuff on our nurses, and I get that. We're going through a lot of changes. I'm not making excuses for it, but I'm just being very frank that it went up.
Yeah.
My goal really was to be able to come back to leadership and say, our nurses know how to do this.
Yeah.
They can do it. They're competent.
Yeah.
They know how to do it. They will do it.
Yeah.
They will do it when it's required.
Right.
If we require it, they will do it. But we're not there yet.
Do you use Rounds Plus for
Yes, we do.
surveys?
Mhm.
Let's talk after. I got a tip
Okay.
for you.
I'm Rachel Cromer from Vanderbilt. I'm sorry, I lost my voice.
Oh, okay.
Quite possibly screaming at the party last night. But
Good for you.
when you said annual competencies, did you mean that you intend to repeat this annually, or that it was part of an annual cycle?
It's part of our annual competency that all nurses and clinical teammates are required to complete to maintain their competency, to show any surveyor like Joint Commission that our teammates are competent in the job that they're doing.
Okay, but it's not on an annual repeating basis.
We typically change it out every year. We don't do the same one every year, but I have had so many people reach out to me and ask me, what did you do last year with that Get Well Network? I want to do it for my team. So I'm sending them. I just sent someone today. Thanks, Misty. I just sent them exactly what we did. But so we're not doing it again this year. Because my hope really is that we'll have an announcement from leadership that's saying, well, we know that you know how to do it. We know you're competent in it. So now we're going to make it a requirement, because that's the first step. Just identify the competency. Yes, you are competent. We knew they were, but they just weren't doing it. And now the next step is to kind of hold their feet to the fire.
Yes. Can I ask one more question about your in-service plan? Did you mean that when your third option was to have an in-service, was it that the staff member was going to lead the in-service or participate?
Yes, they were going to lead it. And I'm happy to share that with you. They were to know enough about the Get Well Network to be able to lead an in-service.
Thank you.
Any other questions? I have a statement if there are no other questions. Okay. Thank you, Michelle, so much. So 2 statements, I guess. We hear you about the reporting, 100%. I will leave this room and I will go to Luann Belay and repeat that I had 70 people in an uproar about reporting, and we need to fix it. So I've got it and we'll address it. Are you ordering through your EMR, the videos at Baycare? Okay. Is the report by the individual person available in your EMR as a report from Cerner? Okay. Okay. And then my second statement is, as the Learning Center, I always say that I'm a part of the Learning Center, but I'm not. I am the Learning Center. The Learning Center is just me at Get Well Network. But as part of our commitment to just really increasing training that's available for Get Well, in the second half of 2020, I will be creating learning modules that you can load onto your e-learning systems. I will just kind of make a blanket statement that you all do things a little bit differently, so there's not a way for us to really tailor it individually, but a generic version of this is how you order a health video through Cerner, this is how you order a health video through Epic, this is how you order it through your management console, this is how you do medication teaching. Those learning modules will be coming in 2020. And we'll also have templates for your competencies, also using the Donna Wright model. So we'll have some templates available as well. Hold on one second. They are recording, so I want to get you.
So we use Discern Analytics. Is that a Cerner product for reporting in Cerner? Yes? Okay. Yeah. So it's possible to build that report probably in Discern Analytics to go to the person level. Do you use Cerner also? Yeah. Yeah, so I just don't know that we have, because we always go to the executive dashboard, so.
Sorry. I came from a Cerner hospital, and those reports, it's the reason I asked. Those reports were available in Cerner where I came from, but I do think it is a build, so I just wanted to point that out. Okay. Okay.
I was just going to share that we did build out a report to try to track through our EMR. So we're Epic, and we had our reporting team build out a report that the managers could pull from their management dashboard. The drawback is you can see if the patient, if the nurse assigned it. The only problem is it could be auto-assigned through, we have a lot linked in care plans, so if it gets included from a care plan, yes, that particular staff member gets credit, but we don't see when the patient completes it who was actually working with that patient to help complete it. There's no way to really track that and give that staff member any credit. And we do track a little bit more heavily on the completion rate than we do our assignment rate, because we auto-assign a lot of generic content.
That's a really good point. And with this particular study, we were really working on the nurses, but it does take a village, and you really can't track it if, we have different teammates coming in encouraging Mrs. Smith to please watch her video, and they're the reason why that Mrs. Smith watched their video, and not necessarily the nurse who ordered the video. But I think what happens if you do put the responsibility on, you have to put it on somebody, I guess, and the only person that we can track is the person who's ordering the video. If we create an environment that encourages the teamwork, then I think we're going to get to our goal. You're right. I mean, there's no way to track all of that, but we make it a team effort, and we put the responsibility in holding them accountable. We have to come up with a way to do that, I think. And I think that's a piece of the puzzle that's still kind of fuzzy, but it's still a piece of the puzzle that we need to solve.
Thank you, Michelle. Any other questions? Well, thank you all for your participation. Thank you, Michelle, for your presentation.
Thank you. It was wonderful. Thank you, guys.